James M. Galloway is an American medical doctor and public health physician who served as the Regional Health Administrator for the United States Department of Health and Human Services under Presidents George W. Bush and Barack Obama. And he's with us here today. How are you doing?
I'm doing great, Toby. How about you?
I'm doing great as well. Now, how did your career start? How did you become this kind of medical doctor working for the government?
That's an interesting question. I left home early and had always thought that I would serve underprivileged folks in some fashion. I wasn't quite sure back then whether it would be legal or medical. Actually, I was leaning towards becoming a civil rights lawyer. But over time, my thoughts became more focused on the medical aspects, and so I went to undergraduate, and then 4 years of medical school, and then 3 years of residency. And as I was going through residency, I'd always thought, that I would focus in on inner city underprivileged populations to serve them. But I had a senior resident who went out to an Indian reservation and said, he didn't enjoy the experience, but it was an eye opener for me to be able to think, wow, I hadn't even thought of that. So I went out to an Indian reservation, initially the Hopi Reservation, which is the famous people of peace who needed an internist, and I happened to be a primary care internist, and to work with them, I joined the federal government, the National Health Service Corps, and here it's called this is the Public Health Service. So I joined the Public Health Service. And I worked for them for 3 years, and then they asked me to run a couple of other hospitals over the next few years. So I did that, and then while I was there, I was doing some research in cardiovascular disease and heart disease, because they had said that heart disease of the ischemic type, that is like heart attacks, didn't occur in Indian people, and it didn't seem right to me. Somehow it seemed very odd. And so I started some research projects and joined others in other research projects, and found that we were on the tip of unfortunately, a big curve going up of heart disease in American Indians. And so I went down and got a cardiology fellowship and stayed at the University of Arizona, where I did my fellowship as an attending, and still within the public health service. So all I saw were American Indians, and treated them from throughout the Southwest. And then they asked me to become the senior cardiologist for the nation for Indian people. I thought that'd be kind of fun. So I did that, and I got to travel to the vast majority of reservations throughout the United States and throughout Alaska, and got to see many of the cultures and got to meet some of the most amazing people in the world. And then they asked me to be the assistant U.S. Surgeon General, and that's when I went to Chicago and became the medical director there. And so I finished out my career with the Public Health Service doing that in Chicago. And then they asked me to join the Centers for Disease Control, which is what I did. It's in the southern part of the U.S., in Atlanta, Georgia. And I joined them, and I was in charge of integrating public health into clinical medicine throughout the nation. So that's what I did as well. And then and since that time, I've been working with a number of different nonprofit or social benefit companies that are focused on improvements in society. So anyway, that's how I got there.
Yeah.
Long answer for a short question.
Definitely. Did you ever think that you would get that far and, actually work properly for the government, or was it just more of a sort of dream thing?
Wow. I had never thought that I would ever go into those kind of positions, because I always thought that I would be a kind of a local family doc treating underprivileged people in some disadvantaged community. I never expected to rise like that. And I really believe, like probably most people do, that our careers are a matter of preparation and luck. You just, if you're prepared and honest and have integrity and you do good work, that you may happen to be in the right place at the right time to move up the ladder a notch or two. And it's so luck's a big part of it for sure.
Yeah, absolutely. And you were the Senior Federal Officer for Health for pandemic influenza, and we're currently in a pandemic. So what do you think about that? Do you have things in your mind that you think we should be doing to help us get out of it?
Absolutely. I think that besides the virus itself, the one thing that's hurt or damaged or killed more people than anything else is misinformation that's been bannered about through politics and for various reasons. The public health science is clear cut. We all know that you need to wear a mask, you need to distance yourself, you need to not touch your face, you need to be away from crowds, and you need to do the standard public health measures that all work together to make a big impact. In fact, some of the biggest impact, short of a vaccine, to save lives.
Yeah. And how do you rate Trump's handling of the pandemic?
I'm sorry, I didn't expect that question. I don't rate that very highly at all. No. I was disappointed that science and and physicians and the CDC were not listened to early on. I think that it was when it was first discovered in China and then announced by China to the World Health Organization and to our government as well. It was early January in 2020. And other than closing the border to China, we really, in the administration in power then, we didn't do much for several months. And I think that's one of the major issues that has put us so far behind the eight ball as a country in our response to COVID.
Yeah. Are there any countries that you think have done a good job? Because there's only one off the top of my head that I can think has done any good job, and they've still had deaths.
Uh-huh. Well, who's that?
New Zealand.
Okay, good. Yeah, so there are. I mean, there's a number of countries that have done pretty good things with this. And I mean, no country and no person is perfect, but there's some very reasonable things that have been done. I mean, probably, the one that I point to and that many others have as well is Taiwan did a really good job. Of course, they're right next to China, so they've had experience with some of the other viruses that have come around and can cause epidemics and pandemics, but they in February 21st they only had 9 deaths. Wow. And they're a small country, but still, that's pretty amazing. And they only had 940 cases. And that was because just what I said before about the U.S., just the opposite, actually. And that is they took early action and were aggressive in their monitoring, in their contact tracing, in their testing, and in their follow-up. They quickly closed borders and they banned the export of masks right off the bat. They did great government contact tracing and they did contact tracing with mobile phones and to ensure people followed the rules. Now, there are a number of other countries we can talk about, but one of the themes that comes through all this is that the countries where the population either trust the government the most or is kind of forced to follow the government the most are the ones where they did best. Yeah. So in some of the countries in your neck of the world, Sweden, for instance, or in Finland, they did pretty good too in doing different methodologies. But there seems to be, and correct me if I'm wrong, because you certainly know better than I, but it seems to be more of a trust of the government in Scandinavia, certainly than the U.S. And there's tend to be more of a trust in what the equivalent of the Centers for Disease Control says, and tend to follow the guidelines. Here in the U.S., it's they're particularly with all the misinformation, there's a lot of folks who, a number of folks anyway, who still don't wear masks.
Yeah.
I mean, very simple, basic things.
Yeah. Here, I think a lot of people don't trust the government, like the Prime Minister, because they didn't vote for him, some people, but most sane people will trust the scientists that are working with the government because they are independent from them and they'd be there no matter who was in charge.
Right. And that's the way it should be. I mean, not about the Prime Minister, but about the scientists, that we should, the professional career scientists who have devoted their lives to the knowledge and the betterment of society are the folks that we should be listening to. Absolutely.
Yeah. And Joe Biden is now the president of the United States. Do you think that he is so far doing a better job of actually listening to the science than Trump did?
Absolutely. He has, he's put scientists in charge and has really taken a back seat. And so now the public health leaders and the Centers for Disease Control and others that are knowledgeable and expert in this field have really taken the lead, and it's showing. I mean, the impact that is happening now in the U.S. is pretty substantial.
Yeah. And how many people have been vaccinated there so far?
Oh, the actual number, I don't know. I read something recently that was like 30% of those over 65, and I've forgotten, something like 15% of those less than 65. So it's somewhere in that neighborhood anyway. Yeah. So it's, about a third of older folks who are at the highest risk.
Well, we've got like most adults now seem to be vaccinated, but then that's only one dose and you need two for it to be like 95% effective.
Right. That's exactly right. And remember that effectiveness, I know they just came out today with the AstraZeneca effectiveness, which looks pretty good. But remember that the effectiveness, like when you talk about Moderna or Pfizer, that, it's 95% effective or 92% effective. What that means is that's how effective it is in preventing symptomatic disease. But in preventing serious disease like death or hospitalization, these things are very close to 100% effective. And that's really what matters. If you don't really want to get a flu or a cold or anything, but you can tolerate that. It's ending up in the hospital or dying from it that really is important.
Yeah. And how do you feel that the post-COVID world is going to be? Do you think it's going to be different to the way it was before? Like perhaps people will start wearing masks as a kind of politeness if they're feeling unwell?
No, I hope that's true. I think that there will be some definite changes. And I think that we'll see the use of masks like we've seen in Asia for a decade or a couple decades now, will be more common in our countries. I also think that, if you think back, at least in the United States history, I can't talk about the history of your country, but in the US in 1918, we had the great pandemic here that was global, of course, but here in the US, once that was over, it was rapidly followed by that period of time we call the Roaring '20s, which was a wild and a party time. And I expect that we're going to see a little bit of that after this entire effort and time with COVID is over. That there's going to be a lot of celebration, certainly. But I do think that at least for a decade or more, people will be will remember this and will be pretty careful. And in fact, there's a more serious side to it as well, of course, in that there is some psychological trauma people have gone through, and that'll affect how they behave and how they respond in the future as well.
Yeah. Absolutely. Actually, the Spanish flu is like, of all events in world history, that's the one that's killed the most people. And most people don't realise that. They think it's be something like 9/11 or some big attack or earthquake. But no, it's Spanish flu.
Yeah, absolutely. And that's the one of the things that is going to come from this, I hope and pray, is that we're going to fund our public health systems better.
Yeah.
It's always when we have these types of crises that everybody goes, we've got to put money in here and we got to really focus in. And then you go for a decade or two without any major catastrophes and the funding goes away. There are other priorities until the next catastrophe happens. And what I'm hoping is we'll learn our lesson this time around and make more of a solid foundation in public health for both our countries and for around the world.
Yeah, it's an interesting thing because it just shows how we weren't really prepared for this at all. Because a few years ago, the BBC did a documentary about what would happen if we had a pandemic. And the kind of way they presented it, I guess it was as far as they knew. The government were completely prepared and had everything ready for us to put the measures in place. But then I guess it never happened.
Right. Well, there's certainly a lot of lessons we can take from this, and one of them is this preparedness, which means having the individuals, having the positions, having the information technology, the communication, and the ability to be able to respond quickly to any type of emergency. It's not just a influenza or a pandemic, or it could be another type of emergency, but emergency responsiveness in general is critically important.
Yeah, absolutely. And we've heard recently about a third wave coming again. Do you think that's going to be a possibility?
Well, yeah, it is a possibility, unfortunately. Yeah. And, a lot of what that's about are the variants that we're seeing, right?
Yeah.
And certainly we're seeing some scary variants that have a higher infectivity, communicability, and also potentially a more serious outcome, a higher number of deaths, for instance. Luckily, the vaccines that are out there seem to have coverage of that as well. And there seems to be some initial data that suggests that the responses that we get from the vaccines are high enough that they would help cover in a meaningful way these other variants as well. Of course, it's too early to know, but those are the preliminary evaluations, and it's reassuring. So I'm hoping that if we can get our populations vaccinated quick enough, that this third wave will be less significant than is feared.
Yeah. And I heard somebody say that if a virus mutates, sometimes it's a good thing because it's actually kind of a mistake that the virus has made, and it's actually kind of became less effective at killing people. Is that true?
It can be. So if you think about the game, I don't know if you have it over there, but we call it telephone here, I think is the name. And you whisper in somebody's ear, and then they whisper to the next person, they whisper to the next person. It goes all the way around the room.
Chinese whispers, we call it.
Oh, okay. All right. And by the end, it's a totally different thing.
Yeah.
Well, it's the same idea with mutations. The virus replicates, and the more people it could get into, the more it replicates. And when it replicates, it makes errors. Most of those errors don't mean anything. They don't affect anything.
Yeah.
Some of them can make it worse, can make it more infective or more deadly, perhaps, but others can make it less effective, just as you were saying too, Toby. So it can go either way, but the vast majority of the mistakes that it makes along the way as it's being copied from over and over and over again don't have any effect directly.
And also, I heard that actually viruses don't want to kill you because that limits the amount of people that you can infect as well, right?
Yeah, that's true with most organisms, right? They
Yeah.
don't want to kill you because if they kill you, they die as well,
Yeah.
and they want to be able to continue to replicate, as you're suggesting as well. So yes, I mean that's the way that evolution has brought these organisms to where they are now.
So how come they do end up killing you? Do they just not understand your body, or is it kind of your immune system that overreacts? What's the case that's going on there?
Well, so the in the big picture, it's the virus survive. If it survives, it tends to replicate, just like in nature, survival of the fittest. If it kills you, then it doesn't replicate anymore. So if, for instance, let's just take a hypothetical. If one of the viruses in me mutated and I transmitted it to you and you transmitted it to somebody else, and that somebody else dies, that may be the end of that mutation, whereas the other ones will continue to survive. So it's selection of the fittest for viruses, just like it is for people.
Yeah.
And the way the virus doesn't have a thought process to think about this. It's all just the evolutionary way that the virus replicates and the body responds. And if it replicates in a way that doesn't kill you, then it continues to live and spread.
Yeah, for sure, absolutely. Well, are you doing any work at the moment in your career that you can tell us about?
Oh, I'm doing a number of jobs right now that are in various areas. One area, again, working with American Indians, is trying to bring the very best, most highly qualified academic physicians to the most remote places in Indian health and rural health in the country. So trying to work with a public benefit company that returns some of the profits to the communities it serves and focuses in on bringing the absolute best doctors to the most remote places in the country and elevating healthcare that way. So that's one of the jobs that I work with. Another job I work with is a lot based on information technology. Is trying to get the folks in greatest need into our healthcare system called Medicaid and Medicare, particularly Medicaid in this case, and trying to get them registered soon as they hit the emergency room through computers and things, rather than waiting the 30 days or 2 months it may take to get them registered, and thereby that has the high crime rates and the disadvantaged section, and developing a international model for low income housing for disadvantaged individuals. And we're focused in on a health and wellness component, which is really exciting and is pretty revolutionary. So those are three of the areas that I'm working on right now.
Yeah. Well, if we want to keep up with you, where are we able to do that? Do you have any social media pages or a website?
I do. Let's see. I'm certainly on LinkedIn. I'm available on LinkedIn as Jim Galloway, as James Galloway. And I think that jamesgalloway.expert, jamesgalloway.expert at expert.com, I think, is the other. But I don't have a lot of social media. I'm a little busy.
Yeah. Well, thank you very much for joining us on the show today. It's been very interesting to talk to you.
Been great talking to you too. And thanks, Toby. Thanks for having me. You have a great day.